So, good evening, everyone. And today we have an amazing guest at our Health Trek podcast. So, Dr. Saroj Dubey, he's a man with a mission and a person who wears many hats. So, he's not only a doctor, a gastroenterologist, but he's also an author, a motivational speaker, and not to forget, a TEDx speaker as well. So, welcome, Dr. Dubey. It's wonderful to have you here.
Yeah,
Um,
thank you so much, Dr. Sona. It's a real pleasure and privilege to be in your podcast. I've been following your work since a long time, as you know, and your books, and we have often had chats. But I think this is the first time we are meeting, so
yeah,
it's
online.
very wonderful to be here. Yeah, online at least.
Yeah, so I'd like to add here that yours was the very first book where I was sort of compelled to take notes in the margins. You know, it's such a wonderful book, RX for Resilience. It's an amazing book,
Wow.
and now it's also
And
available
that
in
was a
Hindi.
huge compliment. That was a huge compliment. That especially coming from you, that you had to take notes and all.
Yeah,
That
yeah,
that, that
absolutely.
really made me
So
look
it's a
that way.
must read. It's a must read. I mean, everybody who likes reading or likes reading self-help, self-improvement books, they should definitely read it. So let's dive right in.
Absolutely.
So, my very first question is, what's the role of mindfulness, in dealing with
Mm.
stress, anxiety? I think that's something that you have been always speaking about. So, what do you think?
Yeah, absolutely, Dr. Sona. That, as you know, that is something which I have been very passionately advocating among people, and the primary reason is that and for the benefit of viewers who may not be knowing about it, to briefly describe mindfulness, in if I were to use just one word, it is just about being present. And although it sounds very simple, but this is a commodity that most of us are lacking, because we are all the time, we are distracted with so many things. And in fact, in the book also I described what one psychologist, Rasmussen, had said, that we are living in what we call a paid reality. So paid is, P is pressure, always, we are under pressure to do our tasks and everything. A is always on. Now, with that, with the disappearance of online, offline, and things like that. So, and with all these 24 hours mail,
Yeah,
you're always supposed to be on. There is
yeah,
no demarcation between your,
yeah,
office and home. And I is information overload. That is such a problematic thing, as you also being a doctor know,
yes,
that so many patients, people, they first they'll do their googling and all, and they'll come with the diagnosis ki doctor sahab mujhe to whatever tumor hai, ye hai, wo hai. And then they'll listen to us. So pain, and D is distraction, always being distracted.
yeah,
So the thing is, because of this paid reality, we are always, our minds are always either in the past or in the future, and very rarely in the present. So mindfulness actually brings us into this moment, and with an acceptance of this moment, rather than a moment which we want to we imagine, okay, this moment should be like that, yeah, aise hona chahiye. Nahi, you accept whatever is happening in this moment and being present with it. And you'll agree that most of the anxiety and stress and worry is because either our mind is focused on something which has happened in the past, why did I say that? Why did I do that? Or why did that happen? Or else we are into the projected future, ki kal kya hoga, this meeting, that meeting, and we lose track of what is happening right now, while
mm,
life is just going on at this moment.
yeah,
And the
yeah,
more we become present with what is happening, we are able to deal with the situation. It's easy to deal with however challenging a situation is right now, but to deal with a projected scenario is very difficult. So
right,
that's
right,
why I feel that mindfulness is
yeah,
a very, very important tool.
yeah, yeah. So, acceptance is something which is a part of your book, a very big part of your book and your thought process. acceptance and non-resistance. I think we should know more about it, and how practically people can look at it.
Look at it. Yes, very true, Dr. Sona. Because as you know, like again, for the benefit of the viewers who are hearing it for the first time. So this book, in short, I start with a chapter in which a very challenging episode had happened in my professional life, where as a doctor had performed an endoscopic surgery, and the patient had ultimately she developed a complication, and unfortunately we couldn't save her. She died.
Mm.
So, that was, although of course the process, that journey of mindfulness and meditation had begun before that, but that was a kind of a sort of tilting point, and it brought me face to face with all the, emotions that I was facing, like fear and guilt and
Mm.
sadness, loss of patient, heartache, all these things, grief. And what I realized is that unless I accept and embrace what is happening, being fully present and embracing what is happening, I'll never be able to fully overcome the situation.
Yeah.
What happens is that most of the time we are in resistance to what is happening.
Mm.
For example, if whatever is happening, like
Yeah.
this was a big problem, but even if it's a small thing, we think, oh, mere saath kyun hua? Why is
Right.
this happening to me? Life is
Yeah.
unfair. It should not be happening. So we are always in resistance, and what we do is that if something which we are not comfortable with, like some emotion, like unhappiness, sadness, what we normally try to do is to suppress that feeling or emotion. We only want the good emotions, the so-called okay feeling of happiness and joy and excitement, but we don't want to face the unpleasant emotions. So what happens is, obviously, if it was possible just to live a half-hearted life, then it would be fine, but it's not possible, and these emotions get buried under. They get buried under, and they ultimately, they branch out and manifest in some form or the other,
Yeah.
sometimes in a physical disease also, or in some other way. So when we learn to be in acceptance of whatever is happening, then and allow and acknowledge whatever is happening, it becomes a very big, I would say, a blessing for all of us. And that's
Right.
why I believe that accepting. And another thing I'd also add, sometimes people think that acceptance is resignation, ki
Mm.
okay, you give up
We
now,
can't do anything.
chalo
Yeah.
jo hona tha, we can't do anything. And that's actually absolutely not true at all. What happens is when we accept, it's an inner acceptance of what is happening, and that frees us of the energy which is used to resist a situation.
Mm.
So we are freed of that energy, and that can be applied to doing whatever is possible. For example, if suppose I have some illness, or I've been diagnosed with something, if I accept it, then I'm not saying, oh, why did this happen to me? It should never have happened. I live such a healthy life. I'm not resisting it, and so that allows me to deal with it in a much better.
Oh, that's very well put. In fact, very easy to understand now that you have explained it in detail. Uh, so for you, it was one trigger, and for somebody, it might have been some other trigger. And the trigger can be
Absolutely,
small, large,
like
whatever.
whatever the thing is, we when we learn to accept the small things, for example, if I'm going if you're going for just to work, and then suddenly the car or
Yeah,
your vehicle develops a
yeah,
puncture, or something
yeah,
something is this thing, or the traffic is very slow, or there's a lot of traffic and things
yeah,
like that. So immediately we start resisting.
yeah,
Obviously, you have to reach on time, but when that mental commentary immediately starts, oh, today is going to be a horrible day. I'm getting late for work, and there's so much work to do. So we start with practicing all these small moments. Of suppose it's very hot today. In summers it's so hot. But what can you do? You have the temperature is, the way it is. So you can do whatever you have. You have a fan or cooler or AC or whatever, and try to keep yourself cool. But at least we don't resist what is happening. So when we
Yeah.
start practicing these small moments, then when bigger
Yeah.
challenges come in
Yeah.
whatever forms, we are
Yeah.
able to, accept those things.
Yeah. 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 So, what do you think about fear? You know, your chapter, the very first chapter, it had a lot of vulnerability, fear, and everything that you were processing. So,
Mhm.
I think it's perfectly normal, and I don't know if it is normalized at all. I mean, it's considered, a big situation that one cannot
Taboo
deal
sort
with.
of.
Mm.
Yes, that's so true. And as you know, uh, as a society, we actually consider being vulnerable to be a sign of weakness.
Yeah,
We feel that, okay, and that is why we have this total polarity of the earlier thing that, okay, the male
हाँ,
ego, they
मर्द को
have
दर्द
to
नहीं
just
होता
be,
है.
हाँ, मर्द को दर्द नहीं होता है वाला and all, which is the cause of so many problems,
Yeah,
across generation and ages. So
yeah,
the thing is, and there's a very nice TED talk by Brené Brown about the power of vulnerability, in which she beautifully explains. And this is what I also realized through my situation, that our vulnerability is our strength actually.
mm,
When we embrace our fear, our, our sadness, and all these emotions, then actually one is that we realize that most of us are connected at some level or the other, and we all face these emotions. Like, for example, in my case, it was that fear about the patient and the repercussions, but we are always in fear,
yeah,
aren't we? Fear for our family safety, our children's
yeah,
safety, our well-being, that our
yeah,
near and dear ones, our parents, we always in fear. But the
yeah,
thing is, we try to suppress it or not face that fear, which causes all the problems. And I realized that when I was able to completely accept, and in fact, I use the word surrender to that fear, surrender to that fear and grief, then actually what happened is that a space, very still and peaceful space opened up around the feelings. And that is anyone can practically, experience that also, because our emotions are not so dense as we imagine them.
yeah,
It becomes dense because we never really open to it or embrace it. But when we embrace it, then that, space creates, and then you realize that there is a space between you and that fear, and that gives you the courage to just accept it, feel it wherever it is in the body.
mm,
And when we are able to feel it and accept it, then we are also able to deal with it better, and we are able to transcend it, rather than just having a fear suppressed in some dark corner
mm,
where it might come out again at some time. And I also realized that when this whole episode was happening, I reached out to a lot of my colleagues and my seniors and my friends, colleagues who are in the same profession, saying that this problem has happened, and I'm really in a very bad state. And so many came out to me and reached out to me saying that we have experienced something like this. So don't worry, you're not alone. We have all so then I realized also that actually all of us have experienced these very
mm,
strong emotions,
mm.
and in our professional or personal lives. It is only when you talk about it, when you open to it, that others, they connect with you and say that you're not alone, and we are all facing something like this.
Yeah. So much for negative emotions. There's a
Mhm.
very important concept that you have always spoken about, and which is positive emotions. So, what's their
Yes.
role? How do we get from this negative to a positive state of mind?
Negative. Yes, absolutely. And that was actually the journey in the book RX for Resilience, where there's a quote of a very beautiful quote by Khalil Gibran, that the deeper that sorrow carves into your being, the more joy you can contain. So what happens is that, that container, that vessel actually expands. It's the same vessel which holds our sorrow and our joy also. And when we are able to deeply feel whatever emotions are there, be it the so-called negative emotions like sadness and grief, I realized, and and that actually motivated me to write this book also, that I started feeling and experiencing, once the episode was over, a lot of more joy and gratitude in the small things,
Uh,
like, and there's a chapter which I've talked about, like awe, wonder, and flow.
yes.
So we always associate awe with something grand, like the Niagara Taj, or Great Barrier Reef or something.
Mm.
But awe moments are there all around us,
Yes.
and just if we are a little still and present, and that's why being mindful is
Mindful.
so important, then we experience these small awe moments, maybe just around us, your the scenery outside, or
Yes.
your pet or your children, or everywhere, so once we are in that state of gratitude and also being present, we experience these moments of awe and wonder and joy. And there's a very nice book by this thing, Barbara Fredrickson, sorry. She talks about the broaden and build effect, where the more we tap into these joyful moments, and the more we start noticing these moments of awe or wonder or savoring, then actually it broadens our whole outlook.
Mm.
Because you can see, for yourself, whenever you are in a happy state of mind, you actually start thinking better also.
Mm.
You start your mental faculties become better, ideas start coming up, and your whole mental
It becomes
vision
positive.
start,
Yeah. Yes. Yes.
it
Yes. Yes.
becomes
Yes.
so
Yes.
so
This is
that is why
brilliant.
it's so important
Mm.
that these we practice these small moments daily, 3 hour moments, or like something like savoring. We always, there are some moments to savor. It may be the snack you had, or just a compliment someone may have
Yeah.
given you, ki, you're something about what you have dealt with another person, or the way you smile, someone may just compliment you, and we can just savor that a few extra seconds. That actually gives us a very good feeling, and it increases our positive emotions.
This is truly brilliant. I mean, if somebody can start practicing it, it's easier said than done, I'm sure. Because,
It's easier said than done, but it's not so difficult also.
mm,
And if we just set an intention that, okay, at the end of the day, or when I'm returning back from work, I'll just mentally note, 2 or 3 awe moments, small awe moments,
mm,
that thing. So what happens is these things become a habit. Once I also started doing it when I read about it somewhere, and then I thought, this is a great idea. Let me see if it's practical or not. And so I would just every day, just note down 2 or 3 small things mentally, or even if someone wants to write it down, they can do it. And then after a few days, automatically I would say, oh yeah, this today, one patient complimented me or thanked
mm,
me, or something happened. I just talked to a friend after a long time or something, and
mm.
you note these small moments, and over a period of time, it becomes a habit in
Habits.
your life.
Right. So this is a beginning of, getting happiness within you. How
Yes,
do you,
getting in touch with these
yeah,
moments.
yeah. How does one create more joy, more happiness, when
In
one
our
is just flying blind or, has nobody to guide them?
Yes. So the most again, the most effective way which I found and I recommend is that when we practice taking small pauses in our daily lives.
Mm,
We are always hustling and moving fast from one thing to another, and we hardly pause.
mm,
And just taking a few moments in between our daily routine. For example, if I can give a practical example, when sometimes in my OPD, sometimes some days there's a bad mad rush, then I would just for maybe after 10 or 15 patients, I'll just close the door for, like, when I'm sipping a cup of tea, I'll just pause for a moment, just connect to my breath, become present again,
Mm.
just present again, ground myself. Just a few moments if we take, then it breaks that cycle of, being in that autopilot mode. And the more pauses we take throughout the day, for example, I'll say that, for example, if someone is returning back from work, if you're driving, you can just, while just before switching on the car, you can just take a few moments, breathe again, pause and reconnect with yourself. If you're sitting behind, then you can obviously, take a few more moments, or when you are on the metro or something. So these are the moments when, rather than just scrolling endlessly for reels or on our smartphones, if we reconnect with ourselves, take these small pauses, we are
Mm.
able to connect with that joy. And
Mm.
another thing is using our senses. Our senses, always our senses will bring us to the present moment,
Mm.
because our senses of hearing, touching, tasting, all
Mm.
these things are in the present. So just when you are probably walking outside, you can just be, again totally present. The birds are chirping, or you see something, and or you just feel the sun against your, the body, and the warmth of the sun. So whenever we connect with our senses, that brings that feeling of joy to
Yeah,
us.
yeah, yeah. It's wonderfully explained. Mm.
Mhm.
So meditation is one of the things that you have suggested, to connect with oneself. What's the simplest way to go about it?
I think the simplest way is, something, because very often I have seen, and you may also agree with that, that whenever we think of the term meditation, or if I suggest it to my patients also, anyone, immediately they start thinking, oh, ye to bada mushkil hai. I have to sit in a particular posture. I have to take out
Yeah,
so a long time, half an hour. I
yeah,
have to be in silence. And some of my friends, in fact, say, "Oh, I can never meditate because my mind is always active and all." Then I tell them that, that's even more a reason why you should do it, and it will help you the most. What I suggest is to do something which is very practical, wherever you are, which can be done in your office, or like even if I'm sitting here, simple mindful meditation, which I've described in the book, where we just sit in whatever comfortable posture we are.
mm,
We just take an anchor, which can be our breathing. Maybe
mm,
someday we can just maybe spend 10 minutes on that in another
yeah,
podcast also, where I can
sure.
guide. So just simply being aware of our breath in and out, and not suppressing the thoughts, allowing that to just come and go. That is, what is we call mindfulness meditation. And the most important thing is to start with small timings.
Yeah,
Sometimes people think that, oh, I have to do for half an hour, and they'll do it for 4 days, and then they'll
that's
say,
it.
I can't make up time. I tell them that just take out 5 minutes in your day, and if you feel like it, if you do it consistently and you start enjoying it, then you can increase to 10 or 15 minutes. So this is what I suggest.
Mm,
One is start, from wherever you are, at whatever state you are. Don't wait that you are going to become more calm and
yeah.
then you'll start. Wherever you are, just start 5 or 10 minutes in whatever position you are, and just do it consistently, and you'll see that you'll be able to make more time for it.
This is really practical because there are so many hurdles where people want to be in the right place and at the right time and carve
Yes.
out half an hour. So this is very practical.
Yeah, like and people very often, some people, they think, okay, meditation and religion is the same. So
Ah,
I tell them that it's not the same thing. If you want to incorporate spirituality or religion into
yeah,
meditation, you are
it
most
can.
welcome. But if you just want to do it, like mindfulness meditation, especially in the West, it's gained a lot of popularity because it is completely secular. You
Mm,
can be whatever religion. There is nothing about this thing. You're just connecting with your own breath.
mm,
And why is that? Because the breath brings us to the present moment.
mm,
So all you're doing is just sitting for a small period with your breath, connecting to yourself. That
yeah,
is all.
great. Yeah. There's something that I've always wondered. Your book, it's something that connects with you instantly, and you start thinking of, how it's going to help you, all your thoughts, and, whatever you have mentioned in the book. So, could you share some incidents where people have read the book and they have come back to thank you, or, I did because, it did help me,
Yes,
but
yes,
any
absolutely.
other
You know,
incidents that you can remember?
yeah, that's very nice question, because actually this has the feedback from people who have read it and how it changed them. That has always motivated me to talk more about it and to spread the word. So there have been quite a few readers. In fact, recently I remember just a month ago, one patient of mine who she had recently developed liver cirrhosis. Although liver functions are okay, but she has cirrhosis. Then she, read the book, and then she came back to me in our next visit, and she said that, Dr. Saroj, my whole life has changed, because over since the time that she was diagnosed, all the time she was thinking, ki, oh, now I have very few years left to live, and and she was in resistance all the time. कि why has this happened to me, and मैं तो alcohol भी नहीं लेती हूँ, cirrhosis only, like people think कि cirrhosis only happens with
Mm-hmm.
alcoholics. So then she realized, she said that the most important thing was I learned to accept and stop resisting what is happening to me. And that I realized was, the thing which was kind of bringing me down the most. And when she started accepting, then she realized that, life was so much more beautiful. And in her own words, she said that now I realize that, every moment is so precious. Like earlier, before the disease, she would say that she thought, "Okay, okay, everything, there are good days, bad days." But now she realized that just because there is a label of cirrhosis, she realized that every moment is precious. Then there was another patient who was having a lot of anxiety attacks and a lot of panic attacks. And then the patient started just by the practice of, mindfulness. And then at the same time, the patient was also taking help from a counselor and a psychologist. But he said that he realized he had often thought of starting meditation or some practice, but he thought it was so difficult. Then he realized that it's very practical, and he started doing. Initially he was just doing it for 10 minutes. Now he says he does it up to 30 minutes.
Wonderful.
So that really made my day. And a lot of other examples of how, just for example, throughout the book I've said that saying yes to the present moment. And that is one thing which a lot of people have carried over from the book, that okay, rather than resisting what is happening, we just allow this moment to be as it is. It can make such a difference in their
Yeah,
lives.
yeah. Wonderful. Just quick last question because we are running short of time. So, your Hindi translation of this book has recently come up.
Yes.
Do tell
Mhm.
us what made you get it translated, and how has been the response? And, I'm sure it adds a lot more people who will benefit from the book.
Yes, actually, when initially when the book came out last year, Richa Anirudh had done a Facebook live interview with me on the book, and that was a very nice interview. And in that, towards the end, she said that a lot of her viewers are, they read in Hindi, so she had, kind of requested that the Hindi version should come out. So from that time, it was there in my mind. And a lot of my patients also, when they would come, they would
Yeah.
see me somewhere on the either YouTube or Facebook, and they say कि we want to read it, but हम हिंदी में पढ़ते हैं, तो ऐसे नहीं मैं करूँगा. तो the publisher Hay House, they said that we don't do in Hindi, but you can always get it published. We give you the rights and all. So then I approached a translator. Then I got this thing, and then I approached a publisher who's Prashant from the Great India Book Tour. So he helped me, and then we got it out. So this has really, been quite good, because a lot of my patients have, started
Yes.
reading it from the Hindi thing. Then I remember one of my one in between one of driver had come to me, and he saw the book and he said कि sir मैं इसको ले जाऊँ क्या? So then I said हाँ बिल्कुल. So he was fond of reading. Then after a few weeks he came back and said कि sir मुझे बहुत अच्छा लगा और इसमें बड़े अच्छे छोटे. So I realized that the reach of the book had increased,
Yes.
and it was reaching a lot more people. So that made me very happy.
Yeah, the reach and the benefit. I mean, the sheer number of
And the
people who
benefit.
will now read it in Hindi and benefit. I mean, it's going to be good. So, so
Yes.
that brings us to the end of the podcast. We hope to see you again, maybe on meditation, like you were suggesting, and how
Yes.
to go about that. So it's
Absolutely,
been,
because even 10 minutes or something, 10-15 minutes in between, if we can do, then people will get the idea.
yeah,
And through your podcast, I'm sure it's going to reach a lot more people. And I
we do
must
hope so.
congratulate you for your program, for your podcast.
Thank
It's
you.
a great venture, and I think it's slowly spreading across and reaching many people.
I do hope it does well. So thank you so much for coming on our podcast and sharing your views.
Thank
Hope to
you.
see you again. Thank you.
Thank you. Thank you so much, Dr. Sona. It was a pleasure. Thank you. Good day.
Same here.
Bye.
Same here.